In this video, I'm going to show you quick tips and mnemonics to remember different classes of antibiotics in under 5 minutes. Hi, my name is Najia Jared with RN PN Tutors USA. I'm a nurse educator and I love to share free tips and tricks with nurses and nursing students. Let's learn new ways to remember these antibiotics. Antibiotics are actually pharmacological agents made from mold. Mold is whatever that you see growing on bread after it stays old. Mold is pretty yucky. Some major antibiotics include penicillin, the cephalosporins, fluoroquinolones, tetracyclines, aminoglycosides, and the macrolides. Our first class of antibiotics are the penicillins. This class of antibiotics ends in the suffix -illin, as in ILLIN. Examples of these drugs include ampicillin, oxacillin, amoxicillin, and nafcillin. Penicillins treat a wide variety of infections, including pneumococcal infections, streptococcal pharyngitis, syphilis, and even gonorrhea. Penicillins generally treat gram-positive microbes. Adverse effects of the penicillins include nausea, vomiting, diarrhea, superinfection, abdominal pain, rash, anaphylaxis, and even anemia. Our next set of antibiotics include the cephalosporins. Usually, if someone's allergic to the penicillins, they're usually allergic to these too. This class of antibiotics starts with the prefix ceph, C-E-F. Examples include cefazolin, cefaclor, ceftriaxone, and cephalexin. The cephalosporins are used to treat skin infections, including burns, wounds, pneumonia, septicemia, UTIs, and even gonorrhea. Side effects of the cephalosporins include a rash, nausea, vomiting, diarrhea, and they can even cause blood abnormalities. Many of the cephalosporins also are toxic to the kidneys. The fluoroquinolones is our next set of antibiotics. This class of antibiotics has the word floxacin in their name. Examples include levofloxacin or Levaquin, ciprofloxacin, otherwise known as Cipro, and norfloxacin. The fluoroquinolones are used to treat infections of the sinuses, gonorrhea, prostatitis, UTIs, the lungs, infections of the bones, joints, and can even be used for preoperative prophylaxis. Side effects of the fluoroquinolones include nausea, vomiting, diarrhea, abdominal pain, dry mouth, crystalluria or crystals in the urine, as well as a rash and photosensitivity. Our next set of antibiotics include the tetracyclines. Tetracyclines are easy to remember because they end in the word cyclin. Examples include tetracycline, doxycycline, and minocycline. If you look closely at the picture, you'll see some yellow-looking teeth. That's because one of the side effects of the tetracyclines is that they're chelating to new teeth and bone. And so we never give them to children under 8 years old. They're also never taken with the dairy products, milk, or antacids. The tetracyclines are used to treat chlamydia, mycoplasma, acne, rickettsia, and even Lyme disease. Side effects of the tetracyclines, in addition to teeth discoloration and poor bone development, includes photosensitivity to the sun, nausea, vomiting, diarrhea, and hepatotoxicity. Remember again, tetracyclines are never given to children. Our next set of antibiotics include the aminoglycosides. The aminoglycosides are easy to remember because they end in the word mycin. We can use the mnemonic GNATS to remember the aminoglycosides. So if you remember NATs, you'll remember the aminoglycosides. So they include G for gentamicin, neomycin, amikacin, tobramycin, and streptomycin. The aminoglycosides are used to treat most gram-negative bacterial infections, including UTIs, bacteremia, and even endocarditis of the heart. Side effects of the aminoglycosides include ototoxicity, nephrotoxicity, paralysis of the skeletal muscles, photosensitivity, as well as superinfection. These are the aminoglycosides. Remember, they end in mycin. Our next set of antibiotics are the macrolides. Macrolides sound similar to aminoglycoside because they have thromycin in their name. If you remember, the mnemonic ACE, as in ACE, A for azithromycin, C for clarithromycin, and E for erythromycin, you will remember the macrolides. Macrolides are used to treat respiratory infections, otitis media. They're also used to treat infections of the eyes, and are used for preoperative prophylaxis. If a patient is allergic to penicillin, the macrolides are usually appropriate. Side effects of the macrolides include a prolonged QT interval on electrocardiogram. Other side effects include nausea, vomiting, diarrhea, fatigue, hepatotoxicity, ototoxicity, phlebitis at the IV site, and even slurred speech. As nurses, we remember never to crush enteric-coated tablets, especially if they are macrolides. If you're giving a macrolide intramuscularly, please remember to give it deep IM. If it's being given IV, give it very slow. Oral or PO should be given on an empty stomach. Thanks for watching. Please check out more of our free nursing tips at www.rnpntutor.com. Thank you.